So my name is Dr. Kaaria. I am a dentist with a specialization in prosthodontics. I'm also a lecturer in prosthetic dentistry at the Department of Dental Sciences at the University of Nairobi. I run Viva Smiles Dental Center together with a partner, and we've been at this for many years. Since inception, I've known Transafrica through the directors, who I'm very well known to, Mr. Adan, Dr. Gakonyo. Those are the founders. Transafrica is really embedded in the practice of dentistry in the country, and it's hard for anyone not to know it, and I'm no exception. At Viva Smiles Dental Center, we've set a very high standard of care, a very high bar of care when it comes to implant rehabilitations. And Transafrica, as a partner, have been there for us every step of the way. They've been able to provide very high quality materials that are known globally and avail them locally at very affordable prices. We have experienced a lot of support as a practice and generally in the market, because for a company, a dealer really, to commit themselves to provide high quality materials as well as training the clinicians on how to use them, that makes Transafrica stand out. And it's not something you see often in suppliers or in dealers. So Transafrica has really distinguished itself in terms of providing high quality materials and providing support, continuous education to practitioners, and as a leading voice in implant dentistry by virtue of being a trainer and being a university lecturer. I see Transafrica as a key partner in the practice of implant dentistry in the country. So when it comes to regeneration materials, these are products that go hand in hand with implant placement and implant rehabilitations. And clinicians need materials that are well priced, easy to handle, and clinically proven. That is very important. And as a company, what we've known about Transafrica is high quality. We provide very high quality materials at affordable prices. And these are materials that are proven through significant years of research. I've gotten to use them with good outcomes. And the after-sales service has come in terms of training. Every year, Transafrica conducts training programs that give clinicians exposure to new techniques, new innovations, keeping abreast with what is happening internationally in terms of providing the best available care for our patients. And that has been very useful for us. They are committed to quality. They are committed to ensuring that the outcomes that clinicians are receiving, seeing in their patients are good. They are predictable and stable in the long term. And therefore, I would say Transafrica has been a good partner. Postgraduate support at the university is something we've been looking forward to for a long time. And one of the pioneers of that has actually been Transafrica Supplies. And it has come in handy because this is a price-sensitive market. Secondly, a lot of patients who seek treatment or care at the university are patients who really need it, and often they are not able to pay for everything. And therefore, when you have a partner who provides materials free of charge, and the only requirement is for our students to make case reports and do presentations in education forums, then that goes a long way in helping our patients. Now, to put it in perspective, as clinicians and as a teacher myself, often you have a case that you'd want to do, provide a certain protocol or a certain level of care, and you're limited because of availability of finances to be able to conduct that treatment. But when you have a partner who comes in and says, we are going to fund that, then as a teacher, you're able to deliver the training that you need to deliver, the patient benefits, and the student benefits as well. Again, to the point of availability of materials, Transafrica is usually very well stocked. Rarely will you have out of stock reports that this and this item is out of stock. And even if an item is out of stock, it can be availed within a short time, within a few weeks. So overall, students benefit. As a clinician and as a tutor, as a clinical instructor, you feel fulfilled because you've been able to provide a level of care that would not have been possible without support by a dealer. And that really is where we should be going as an industry, where we have partners coming in to support universities and giving us an opportunity to provide very high standards of care and delivering the teachings that are at par with the rest of the world. I believe the most significant achievement of Transafrica Medical Supplies is a partnership with a global brand named Straumann Group. And through the Straumann Group, many things have been possible in Kenya and East Africa. And one of them that I take pride in is the establishment of ITI Study Group or Study Club in Nairobi. Of course, under the southern section, but without the partnership that took place between Straumann Group and Transafrica, that would not have been a possibility. And that has spawned a lot of good, because now clinicians are more aware of what is happening in implant dentistry globally. We're able to connect and participate in forums with experts, world-renowned experts, in webinars, in study meetings, in congresses, all thanks to the ITI, the International Team for Implant Dentistry, being established in Nairobi. I pride myself as part of the leadership of the Nairobi Study Club, and through that we've drawn in people in academia, we've drawn in a lot of clinicians with interest in implant dentistry, and they keep abreast with what is happening through the ITI. I'm hoping to see deeper partnerships between the academia, that is the universities, and the industry, and Transafrica coming in between as the link between academia and industry. Often industry moves faster than academia, and when you don't have partners who can bridge that gap, you find academia is left behind. I'm also looking at a situation where Transafrica starts local manufacturing, and as a company with a lot of potential, with a lot of promise, I'm hoping we can see some of the products that we use locally manufactured locally, and even implants are no exception. I'm hoping we can be able to manufacture locally and use homegrown products. That will go a long way, and I don't need to get into the economic benefits of that. Thirdly, I hope that Transafrica grows into a global brand, a global giant, out of Kenya, out of East Africa, to establish itself as a leader in dentistry, supplying a wide range of products. My focus may be implant dentistry, but I care for good dentistry across the board. So I want to see Transafrica growing into a large brand that has strong systems, good processes, strong teams to support its customer base, and just have immense success going forward.